Good morning, everyone. Welcome to the SEOW summer, excuse me, we were just talking about summer. Welcome to the winter meeting that we hold every January. It's great to see you all joining this morning. If you would be so kind as to sign into the chat, let us know you're here, what organization you're representing, anything you might want to say about your use of the data. We would love to see that. And we'll get started in a couple minutes. I just want to mention, I think you all got the electronic message. The meeting is being recorded, so you're all aware of that. But it's wonderful to have everyone back together for the new year. Hi, Sean. It's good to see you representing Wilmington University. I see.
Good morning.
How's everything going?
Pretty good, pretty good.
Good.
Lots of students ready to go out in the world and create new professionalism for prevention science.
Wonderful. That's so exciting. You get to work with people who are so optimistic and at the beginning of their journeys. It's very exciting. Good to see you, Jennifer. And Terry. And Nuno. Is everyone, we were just reminiscing. Some of you have been involved with the SEOW long enough to remember when we met in person way back before the pandemic. And we were reminiscing about how our timing was always so perfect that we had such horrible weather on the days that we selected for the winter meeting. But the last one was particularly challenging because there were predicted snow squalls, and I think MJ said it was like cyclone bombs or snow bombs or something like that. And all of us were waiting for this to happen and, back and forth. Is this meeting going to take place in person or not? And as we were driving, it looked pretty good when we all left our respective spaces. But while we all got on Route 1, there were these whiteout conditions. And it was like, oh my goodness, we couldn't believe that we were caught up in that. So one thing we don't have to worry about today, but
we made it. We all made it safe there, and it was great. It was a good meeting. Good morning, everyone.
Did. So thank you for signing in. It is about 9:32. Do we want to give it another minute, MJ, before we roll?
Yes, please, ma'am. So
for those of you who are just joining the room, we've asked you to just sign in, let us know where you're from, and just welcoming you to the meeting. Hi, Sandy. Hi, Sabra. Janice. Good to see you all again. Lauren, Alexis, and Shauna, Orlando, Bill, and Jessica, Shafuya, So I'm Sharon Merriman Nye with the SEOW, which stands for State Epidemiological Outcomes Work Group. We are based at the University of Delaware Center for Drug and Health Studies. We facilitate the SEOW on behalf of DSAM with funding that they receive from SAMHSA and other projects. I'm here today with MJ Scales, who is the leader of our team, and Rachel Riding, who will be presenting later on NISDA findings, Dana Holtz, Dr. Dana Holtz, Rochelle Brittingham, let's see, Stephanie Ha, who is one of our research assistants, Bill Gratton, another research assistant. I'm looking, am I missing anyone, MJ? From our team?
No, ma'am, not from CDS. Oh, and our Shauna Leahy is also a graduate research assistant at the university, or excuse me, at the center, working on a different project, a prevention focused project.
So we have a pretty broad team with lots of different areas of experience and things like that. And we meet twice a year in this larger group session with network members. Throughout the year, we host smaller events that are intended for a broader audience. I said smaller events, but I mean, they're more pointed, focused presentations called 3D data discourses. So we try to keep, the network activity flowing throughout the course of the year. Today's meeting will be recorded, as I said. Have we hit the record button? Yes, we're recording.
Yes, ma'am. Yes,
Good,
ma'am.
great. We will be posting this later on our YouTube channel so that anyone who doesn't make it to the meeting or might have to leave early or what have you can later log in and pick up the presentations that will be coming along. We also post all of our materials online. So for those of you who might be new, just letting you know about that. I think at this point, I'm going to ask anyone who is new to the SEOW meetings if they would like to unmic themselves and introduce themselves and just say good morning to the group and let us know what your specific area of interest is in the data.
Mommy, where did you pop up on the chair?
Good morning, all. My name's Sandy Saglaski. I'm new. I'm on off camera today. I've got a kiddo home from school and some dogs, so I'm trying not to be too much of a distraction. I work with Project Delaware with DSCYF and DOE, and I'm interested in learning about information regarding children.
Mommy.
Thank you.
Mommy. Where did
Thank you so much. Thanks for introducing yourself. It's good to see you again, even not see you, Sandy. I appreciate it.
Likewise, Sharon.
This is my first SEOW meeting. I'm Jessica. I'm the coalition coordinator for Planet Youth Coalition, which is a drug-free communities coalition in North Wilmington in the 19809 zip code, which is why I am currently at CADCA in a hotel room, which is the annual conference for coalition training. Data that we're interested in is usually specific to our area mostly. We serve 19809 and, depending on the grant, other nearby zip codes. In particular, anything that is related to ages 12 to 17 youth, or well, and also young adults.
It's wonderful to have you here. Thank
Planet
you.
Youth Coalition and the Cause and Bellevue Community Center is doing some really amazing work with youth-led messaging. And it is really phenomenal to see the young people getting involved in not only the development of that messaging, but the dissemination of information. And they're being, Planet Youth Coalition, Bellevue, and the Cause are really being smart about developing young leaders around these issues, because not everyone wants to hear from old people like me, right? So a lot of times the way they see it, the young people see it, the way they incorporate and disseminate that information is innovative and new. So I'm very excited about the work that they're doing.
Thank you, MJ. And we actually have a youth here. He is interviewing preventionists and other attendees at this conference. And he's also going to the youth track of activities on prevention to bring that back to his peers so that we can gauge interest for a group coming to CADCA in July or next year.
That is great. Wonderful. Well, I'm wishing you all a wonderful conference. It must be a very exciting time. And
thank you. Oh, it is. Well, and above all, I mean, I've just seen spectacular examples of young people who speak the language of prevention, who are science focused, like passionate about the science, and they're teaching younger people, like it's teens teaching younger children. Really exciting stuff.
it's great. Well, we're happy that you're joining us and making that effort to join us while you're at the, at the conference. It's always really cool. So Is there anyone else that's new that would like to introduce themselves to the group?
My name is Orlando Foreman. I'm representing Network Connect. I'm a community well-being ambassador. This is my first time. I've had the pleasure working with Miss MJ. So I'm thankful to be on here today. My camera's at, there you go, that's a little better. But hello, everybody.
Hello and welcome. Thank you. I think everybody's worked with MJ and had the pleasure to do so.
No, I don't know about that, but Network Connect is doing really some amazing work. That ambassador program is using a peer model, kind of similar to what Planet Youth Coalition is doing, is using that peer model to get to folks that maybe are oftentimes left behind or have needs that are not met by traditional systems. And so the ambassador program is doing a great work in that space. It started off as a pilot program in certain zip codes in Wilmington and has expanded out. And now the second iteration of that is down in Dover. It's a really amazing project. And the Network Connect also has some work that they do with young people. If you do not have a race kit, which is focused on adverse childhood experiences and affirmations, is a really cool box. If you do not have one, please definitely reach out to Network Connect, and we can drop their website in the chat for you to learn more about their program, because they're doing, again, another community partner doing some really amazing work.
That's right. And I just wanted to mention that later in the meeting, we will do, we'll dedicate some time to resource sharing, where members are asked to share any information about new materials that they might have or initiatives and so on and so forth. But at any point, you feel free to pop in the chat anything that's relevant to the work that we're talking about today. You know, add your websites or what have you. We're happy to do that. We distribute a document with these resource links and such listed after the meeting as part of our materials. So please feel free to use that chat throughout the day. Okay, morning. I don't want to scare anybody. Morning. Okay. Anyone else that would like to introduce themselves? Okay. I think then it's time for us to roll the slides, MJ. Okay.
Yes, ma'am.
Thanks.
All right. Again, welcome everybody. Sharon had mentioned what our outline for today was. We've already gone through some welcome and introductions. We'll very briefly go over the goals of the SEOW for those maybe who are not familiar, and kind of just to orient ourselves about why we come together, what our purpose is. We have a few SEOW announcements. We will share with you our data champion for this period. We will discuss some highlights from the field. Dr. Rachel Riding will be going over some key findings. There's a lot of really good data that's come out since the last time we were all together, things like NISDA, the Trevor Project, and Rachel's going to provide some key findings and also how to connect with those things for yourself if you want to dig in deeper to that. Our main speakers today are going to be from CHOP, specifically the Poison Control Center. And there was an interesting article that came out a few weeks ago about edibles as a potential point for poisoning. And so they're going to talk a little bit about that, which I think is really relevant to this group and timely with, efforts for legalization of marijuana or decriminalization for cannabis. Then we'll have a breakout. And then, of course, as Sharon mentioned, we'll share out any, provide the opportunity for anyone to share out materials and events and things like that. So just again, to orient us, there are 4 goals of the SEOW, or State Epidemiological Outcomes Work Group. The first goal is to build monitoring and surveillance systems to identify, analyze, and profile data from the state and local sources. The second is to identify, share, and analyze data. And the third is to create data-guided products that inform prevention planning and policies. And recently, through state support, that has gone beyond prevention planning to behavioral health planning more broadly, including mental health and treatment and harm reduction and so forth. And lastly, to train agencies and communities in understanding, using, and presenting data effectively. That may be something like a grant application or a presentation for a school that you all are doing, or a parents group, and you reach out to us for information. Since we last saw you in July, there have been a number of different products that have come out. We completed an infographic around suicide, defining it, kind of giving some national statistics, as well as rates and resources and so forth. Another infographic was around older adults and substance use, which is a population that obviously that sometimes is not in the forefront of the conversation around behavioral health, but nonetheless is a priority population. As Sharon mentioned, we also do more focused webinars, and we did one in December with highlights from the 2020 Epi Report. That recording is available on YouTube. We can make that link available to you in the chat. From that, we also completed the 2020 Epi Report. The slides are available online. The Epi Report is also available online. And here are two of the infographics. These are available for you to download and use as you need. So you can use these in PowerPoints that you're doing with community members. You can use them as handouts at different events. You can attach them to start conversation. And here I've pulled out two that I think that are most relevant, but are those protective factors, because as we've discussed, many occasions, whether we're talking about mental health or we're talking about substance use, it really is an everybody problem. It is all hands on deck. There is something for everyone to do, not just parents, not just teachers, but professionals, grandparents, coaches, mentors, and the like. And then we obviously always want to, talk about the role of trauma in that work as well. And again, these are available online. We can provide those links to you as well. And these are updated with the most recent available information. For those of you who are currently network members of the SEOW, there's currently a stakeholder survey out. You may have received an email. It'll say, Maisha Scales is inviting you to take this survey. If you could fill out that survey, it'll be open for another couple of weeks. Again, it would be an email invitation. We're not going to provide the link to that. But if you could provide your feedback, that would be really helpful. We want to always be responsive to the network and do things that are not only in line with the state's vision, but also support our community and state partners and are very useful to you, whether that is, I think the 3D webinars actually came from a response of wanting to get more into certain data points and more involved and have a more in-depth conversation, kind of like a lunch and learn. And that came from stakeholder feedback. So we do take that feedback and try to refine products and refine processes that the SEOW does in order to be extremely responsive to the needs of our members and stakeholders. If you have a question about the survey, we can put my email in the chat and then we can reach out to you if you have any questions. Okay, so because this is a network, and a membership, and not membership, that makes it sound a little like there's a fee, but we really do appreciate, we would not be as successful as we are without the different partners that are a part of this stakeholder network. Not only are we privileged to be able to share data out, we also have the opportunity to learn from others in our network, a different way of looking at something, a different way of building capacity, both internally, but also for the larger field of behavioral health. And to that end, we want to recognize our partners at Kids Count. I believe Janice Barlow is here today, but we want to recognize our partners at Kids Count. Not only are they users of data such as school survey data, but they also are great partners in webinars and discussions. And, I know personally, I've been able to call up Ms. Barlow and say, I have a question. How do we get the word out? How do we become better at doing the work? So I just want to take a moment to recognize Kids Count and specifically Ms. Barlow, if she is here.
I'm here. Thank you. That's so exciting. We love the data that you allow us to kind of get out and enhance what we do. I'm going to add another URL to the chat, which is datacenter.kidscount.org. All of the data is shared there in interactive ways. You can pull it down in maps or trends or bars and put it into your websites and into your grant reports and all of that. So thank you. Thank you.
Sharon, did you want to add anything?
Yes, I just wanted to say that we really appreciate the resources of Kids Count. And we know that they're far reaching. We're happy to have this longstanding collaboration with you all. And just the wonderful work that you're doing for, what is it now, Janice? Is it 25 years yet? It's been a very long time and incredibly successful and growing every year.
Yeah, we hit 25 years right as COVID hit us. So we're up to about 28 now. So awesome.
Okay. Well, we'll hope for another 25 more years. Okay, at least.
Definitely, definitely.
Thanks.
Thank you.
And I just want to again emphasize that this is a phenomenal resource when you have time, because you could really go down a rabbit hole with Kids Count because they've got so much rich stuff in there. And they talk, there's the trend information and how kind of things are intersect and align. And so if you have some time, definitely dig into that web portal as well. All right, so next up, we are going to have the presentation by Dr. Writing, pulling out a few recent reports of interest, which we think would be really relevant to this group. Dr. Writing, just let me know when to move things, okay?
All right, thank you, MJ. So yeah, we're just gonna briefly just highlight a few more recent reports and data resources that have come out in the last few months since the last time we got together that folks might find interesting or useful in this group. We're going to talk about the new NISDA national report, a new CADCO report on fentanyl. Mental Health America has a new data dashboard on their mental health screening data, and the Trevor Project also has new state comparison reports for LGBTQ mental health, which is a really interesting resource. You can go to the next slide. So first is the National Survey on Drug Use and Health. Earlier this month, I believe it was, they released their national report of their 2021 survey data. This includes a lot of information related to substance use disorders, mental illness and co-occurring substance use disorders, data points related to suicide, substance use treatment and mental health treatment. And they also have some questions now on the impact of COVID-19 on people's substance use, mental health, and accessing treatment and those kinds of things. So there's a lot of good information in this report. And I believe Stephanie's dropped a link in the chat. So that link will take you to the report. And they also have some frequently asked questions related to the data and some good methodology notes to accompany the data. One of the things with a lot of the data that's been collected since the onset of the pandemic is that it's not always comparable to data that was collected before the pandemic, if you're thinking about doing trends in certain things. So that's something to pay attention to when you're looking at a lot of these national data sources. The pandemic kind of necessitated folks using different means of collecting data than before. So it means that sometimes the data isn't always comparable. So with the NISDA, along with some other national data sources, they're cautioning that the 2021 data, you really can't compare it to 2020 or 2019 and make a strong claim about like substance use increasing or decreasing among these populations necessarily. So that's just something to keep in mind as we're looking at this data. You can go to the next slide. And they also put together all of the graphs and charts from the report. They put them together into a PowerPoint that you can download. So this is a really great resource too, because you can get the PowerPoint slides already made if you want to use them in presentations or just to access the information a little bit easier. So I've pulled out just a couple of slides. It's actually 5 slides, not a couple. But I pulled out 5 slides from their report just to kind of give a a taste of how they put together their data, how it's displayed, and some of the things they have in here. So this first one, we're looking at past month tobacco use or nicotine vaping among people aged 12 or older. So they've got, from their survey, 22% of the national population has used tobacco or have vaped nicotine in the past month. And if you go to the next slide, they break this data down by age and into other demographic categories. And I think this age one is interesting because they show the patterns in vaping versus using traditional combustible cigarettes by age, again, highlighting that nicotine vaping is much more prevalent among the younger age groups. So that second bar is ages 12 to 17. So in that 12 to 17 age group, the majority of the youth who are using nicotine products are vaping nicotine. And as the age groups get in that older range, cigarette use becomes more prevalent among folks who are consuming nicotine in some way. Next slide. They also have lots of diagrams in this format. I don't think this is technically a Venn diagram, or maybe it is technically a Venn diagram, but all the bubbles are inside themselves. But so this is a look at the folks who are using alcohol, and then the percentage within the folks who use alcohol who are binge users of alcohol and who are heavy users of alcohol. So seeing that visual representation of, among the folks who are reporting past month alcohol use, what slice of the pie is folks who are then binge using alcohol, which is 4 more drinks in a sitting for women and 5 or more drinks in a sitting for men, and then heavy alcohol use. And they have charts like this for all of the different substances that they track information for. And then the last two we're going to look at from their report. Here we have a more complex Venn diagram looking at youth aged 12 to 17 with serious thoughts of suicide, suicide plans, or suicide attempts. So 3.4 million youth aged 12 to 17 had these thoughts or plans or attempts for suicide in the past year. And then they kind of break that out looking at some of the different overlaps within that group in terms of who had thoughts alone but didn't make a plan or didn't make an attempt. And then from there on out. And then the next slide. And with all of this data, again, they'll give you the overview and these cool Venn diagrams and charts looking at it, and then they'll break it out a little bit more so you can get a little bit more detail. So they've asked, following up on this question of, having suicidal thoughts or plans or attempting suicide, they also ask, for those people who have had serious thoughts of suicide or suicidal behaviors, what percentage of those was it specifically because of the COVID-19 pandemic, which I think is really vital information because we know how detrimental the pandemic has been on folks' mental health. And they have this for all age groups. I just pulled out the 12 to 17 for this particular presentation, but I would encourage you to look through this PowerPoint from SAMHSA if you're interested in looking at those other age groups as well. But here, they found that 15% of the youth who had suicidal thoughts or had made plans or attempts for suicide, 15% of those said it was specifically because of the COVID pandemic. So again, lots of really useful information there. And these links will be shared out to you all via email as well after this presentation. If you want to follow up on this a little bit more, you could probably do a whole day conference presenting the NISDA data from 2021 because there's so much of it. So this really was just the highlights. We can go to the next slide. The next data resource I want to highlight, and I know someone mentioned that some folks talked about CADCO when we first started the meeting, and CADCO has a new issue of the Practical Theorist report series, and this one focuses on fentanyl. So we can go to the next slide. So it includes a lot of information about pharmaceutical fentanyl and the emergence of illicitly manufactured fentanyls, the impact of fentanyl on overdose deaths, geographic distribution of those deaths, the impact of the COVID-19 pandemic on these drug use trends, and also highlights towards the end of the report a lot of prevention strategies and resources. So we can go to the next slide. So here's one example from towards the end of the report. They highlight their 7 strategies for community change and how you can use those to prevent the use of fentanyl. And they also provide a list of partner resources on fentanyl, including data resources, communication materials, and a lot of different like toolkits and guides and things that can be downloaded and used in your work. So that the link to that report is in the chat. And they also have a webinar presentation on the data in this report that's available on YouTube, and they have a link to that on the page that we've sent you as well if you want to find out a little bit more about this. But another good possible resource for folks. The next slide. Mental Health America has also created a data dashboard that's pretty neat, that we also wanted to highlight for folks. They're calling it Mapping the Health of Our Communities. And what they've done is they have virtual screening tools available on their website for folks. And they have screeners related to depression, suicide, PTSD, trauma, and psychosis are all the things that they have data on. And they've put into a dashboard and are reporting the results from all of these online screenings that they're receiving. So the dashboard contains data collected from their screenings from January 2020 through December 2022. So it's pretty recent. We're in January 23, and we've got through the end of last year. And you can sort by the data by year, by age, by state, and by county where it's possible. I think they've suppressed responses if they have less than 5 screenings in a county. They don't display that, but otherwise you can get county level data for this. And this is another one where I would suggest looking closely at their methodology reports on their website if you do want to try and use this data, because this is more of a self-selected group rather than necessarily a survey of a representative sample of residents in a specific state, because what they're reporting is responses from people who have gone online themselves and taken a screening to see if they're suffering from depression or PTSD or any of these other conditions. So it's not necessarily a representative survey of the whole population, it's the numbers of folks who have taken these screenings. So it's interesting because it's a group that may not necessarily be captured in traditional data sources that might be reporting screenings when folks go to the doctor. These are people who are from their own home taking these screenings themselves. And here's just one example of what this would look like for Delaware. One of the things they've reported is individuals who self-identify as trauma survivors on any of the mental health screens that they have, and they've put together those numbers. So, and then you can see that by county. So they have in their dashboard that there are 803 individuals in Delaware who identified as trauma survivors from going to their screenings, and then they've put together that rate by county. So again, you can go on their website, you can select the state you're interested in, you can look at the year, there's an age filter, and you can look at different counties, and it's a neat tool. And then the last new data source that I'm going to highlight today before turning it back over is data from the Trevor Project. So if you're unfamiliar, the Trevor Project is a nonprofit with the goal of preventing LGBTQ youth suicide. And they offer, they have like some crisis counseling and things like that online. And they also do a large national survey that they've been doing for a few years now. And they model a lot of their questions off of the YRBS. And in 2022, so this is actually survey data that was collected at the end of 2021, they've reported in 2022. But for the first time, they've put together state comparison reports. So this includes data points related to mental health and suicide risk, access to mental health care, challenges faced by LGBTQ youth, ways to support LGBTQ youth, and then some of the demographics of the folks that they survey. In their 2021 survey, they got about 34,000 responses nationwide. They survey young people ages 13 through 24, so it's youth and young adults. And yeah, if you go to the link that Stephanie has shared in the chat, you can find these reports. This is just to pull out of a couple pages from the Delaware specific report, but they have reports like this for every state with some of these highlights. So this is highlighting access to mental health care among LGBTQ youth in Delaware that they've surveyed. So they found, for example, that 65% of LGBTQ youth in Delaware who wanted mental health care in the past year were not able to get it. And then they highlighted some of the reasons why someone might not have gone and gotten mental health care, weren't able to access it. And then they've also highlighted ways to support LGBTQ youth in Delaware. You know, the percentage of young people who they've surveyed who felt they had affirming families or affirming homes, or that school is a safe place for them, if they felt accepted in their community. And they've got, you know, other data points that I haven't highlighted here, but again, this is a great resource. This is a population that we don't always have a lot of access to good data on, or not always state-specific data. So great that we have state level data from them as well. And they also have on their website a pretty neat data dashboard for some of their national data. If you go and play around on there, it's a very great data source, and we're excited to be able to highlight this as well. And I believe that's all I have for new data highlights for this presentation. So thank you, MJ.
Yes, thank you, Rachel. We have a little bit of time before our main speakers here. I wanted to open up the floor for any questions for Rachel, or any initial thoughts about the data that you've seen here today.
I have a question, MJ.
Yes, ma'am, go ahead.
Sorry, I was listening, and I think you went through this a little bit, but could you send me information again about the methodology that was used by, or if you have the methodology that was used by the Trevor Project to capture LGBTQ youth mental health, behavioral health in Delaware and other states? It's this is an incredible resource, and I'm so glad that you've shared that for some of our grant writing opportunities, because I can never find information on LGBTQ. So is there like a snapshot on the methodology?
Yeah, they do include one in their report and on their website, and we can make sure that we pull that out for folks. You know, I really appreciate Rachel pointing out that how data is collected is going to vary from source to source. And so oftentimes we can't, it informs a conversation, as you already know, but that sometimes we don't want to take that and then compare apples and oranges, right? So I don't want to compare Delaware YRBS to some other resource, NISDA, say, for example, because the methodology is different. What may come out of that's different, definitions are different. And so I would encourage everyone to make sure that they're reading that methodology section. And NISDA did a really good job this year of saying, you know, is this appropriate to compare across time? What might there be challenges to looking at this data post COVID, if that's a thing. So I think that's really important. I really like the Trevor Project because for folks who do work in this space, or folks who work with young people in particular, who you know, it allows the Trevor Project allows young people, and just all respondents actually, to self-identify. And I think it really highlights the fact that we are not, it's not a, you know, it's not a binary. It's not, you know, when we're allowed to articulate our own identities, it is more rich than we give people the opportunity to do that in certain data collection instruments. So I would strongly encourage you to take a look at that, and we'll provide that afterwards. And I know folks are putting it in the chat. Yes, ma'am. Yes, Ms. Graham.
I was wondering if, as part of that report, did they catalog any resources state by state? Because I have been curious about what exists in terms of support groups or counseling, like LGBTQ youth focused services and resources in the county or in the state. And I don't know if that's collected in this report or somewhere else.
So I don't think it's collected at the state level, right, Rachel? There's not resources listed at the state level. I think they're more national than that. What I will say is that there's certainly more work to be done in this space, and we have a few clinicians with us today. And there is a large resource gap when it comes to LGBTQ plus children in Delaware. There are a number of providers who, Transitions Delaware. Reverend Fleshman is a good resource in that way, and I'm happy to connect you with after. Meaning she's not here today, but I can certainly connect you afterwards. Because there's a difference between saying we provide affirming care and we're just, we're here, we're not gonna make you feel bad, you know what I mean? But are we, to use the phrase culturally competent, are we culturally responsive? Are we culturally sensitive to the needs of our clients and our consumers? And I would say that that's certainly a gap in Delaware.
Because more generally, I'm interested in, the coalition is interested in assessing what is out there in our area for youth, period, right?
Mm-hmm.
All the amenities and services and resources, but in this particular area, so GSAs at schools, or support groups that exist, maybe at a community center, things like that, as well as, you're right, I mean, also clinicians. There's a difference between clinicians and yes.
I'll make a blanket statement.
Mm-hmm.
We could all be doing more. There's certainly not enough, no matter how you look at it, whether that is, in school, whether that is in community. We could all be doing so much more in that space.
For Brandywine, we're working on collecting the resources that are available for youth, and ultimately having a sort of a share house online about this for Brandywine. So,
and one of the things that you all do really well, and that's that piece of culturally responsive activities implementation, is that you all have, members of the coalition who represent that population. And then I know in the past, Mr. Elkins has run certain instruments or different things that we wanted to do from an evaluation perspective by different folks, and saying, how does this resonate with you? Before we push it out to the larger group, how does this resonate with you? Where are we missing the mark? And so that's a great way and a great example to be culturally responsive.
MJ?
Yes, sir.
It's Bill Lynch. I just have a suggestion with
Hey, sir.
regards to that. I don't know if the SEOW can take this on or not. It looks like Jessica Graham with Planet Youth has started some of it. During the pandemic, New Jersey State Police actually compromised what they called a resource document. And it could be actually something that's used by SEOW or some other group in Delaware as a template. And what they did was they collected all these resources, and they also put them up by county for the state of New Jersey. So it's only the 3 in Delaware. It may be something that's easier to put together and then make that available to everyone. And they looked at all different kinds of facets with regards to the pandemic, whether it be employment, food sources, that kind of stuff, mental health, where they were having meetings that were online or not online, those kind of things. So I don't really know who in Delaware would be able to take that on, but it would be a template that someone could follow to actually get those resources collected and then be able to disseminate out to a wide audience, including this group and others in the state of Delaware.
Thank you for that. If you have a form that you want to send my way, we're happy to take a further look at that. And it is likely not going to be us, but we can, partner with other folks who are doing work in that space. And that's the beauty of the SEOW, is that we do, we can facilitate that conversation, even if we're not the ones actually doing it.
Yeah, and they made it a link too, MJ. So what I'll do is try to find that for you. That's up on the state website, and then you can look at that. But thank you.
I appreciate you, sir.
and that's a really interesting way to approach it. It's sort of a Wikipedia type of approach, where if there's a form, if there's a way to input it, then people all over have different lists. And so over time, they could all be combined into one.
I want to acknowledge Katie Capelli from DPH, who I think is doing something similar with that with SUD.
Thanks, MJ. And I had it up as Kate Perkins. Kate is also here as well, who is the director of our office. So I stole her link and it had my name as Kate Perkins. So I apologize. I'm here, Katie Capelli. Our office actually has been working the last, I would say, 2 years on sort of an inventory of resources around substance use disorder. So it's very specific to substance use disorder, but I put in the chat the link, SUD-DE.com. We are sharing it with our treatment partners, our prevention partners, our our linkage to care partners, to collect an inventory of the resources available for different populations, including youth specific programs. Again, it's been a 2-year process. We kind of piloted it last year and kind of reviewed it over the summer to try to get some of the kinks out, use it user-friendly, more feasible, more easy to access. Our vendor worked on making those adjustments, and I would love if those who are interested in helping us put together this resource guide, again, it's substance use disorder specific, to take a look at that and perhaps fill out the information on their respected agency. Again, this is kind of an ever-evolving project, but ideally it would be a way to connect substance use disorder resources to our partner agencies to be able to do just that, learn what's available and be able to share that with your cohort population.
Thank you, ma'am. Other thoughts, other ideas?
I just wanted to mention that I put in the chat the link for Camp Rehoboth. Someone had asked the question. They do have a resource listing, so that's available as well at this time. And the United Way Pride Council used to have a resource guide posted. I'm not sure. I was on the website trying to find it. I'm not sure if there is actually still a resource guide, but they are a resource for the state of Delaware in terms of GSAs and support and partnership and things of that nature. So those are just a couple things I wanted to mention.
And related to that, I mean, it's cumbersome, but at least you can initially find some resources through Delaware Helpline. I mean, there's a lot of organizations and programs, and again, it's not easy just to put in, give me youth programs for the mental health, but it's a good initial start. And they used to actually have a form where you could submit programs to them and stuff like that.
Thank you.
And I'm going to be radical here and say, if you're thinking about what the needs are, ask people from the population that you want to serve, right? That's one of the ways that it can be most effective, because I know that often our intentions are in the right place, but we create more programs and more programs, and they're not always effective because we haven't included the people we want to serve in that initial development and conversation and monitoring progress along the way. So where the need is, I think folks, whether that is folks who have low financial resources, or folks who are LGBTQ, or folks who have disabilities, the best way to ensure the success of any particular intervention is to include them from the very beginning in the development and understanding of that. So, but I love the passion for it. Honestly, I do. We've got, yes, sir.
So MJ, I have a question. I hate to
Yes,
piggyback backwards. When you were talking about the LGBTQ data, so in some of my programs with youth, I've noticed that I've had quite a few that has been dealing with that. So my question is, how can we get into the schools better and connect and try to see how we can better serve the kids? Because a lot of kids are going through a lot of bullying in school, and make some of them even suicidal, anxieties and depression. And I saw it firsthand for myself. And so I'm just curious what can be done to kind of assist them in a stronger way.
Yeah, I think that's a great question. I mean, I want to open that to other folks who are here. Dr. Lawler is obviously very knowledgeable about the schools and school systems. But I would say in general, I mean, a universal strategy is to provide that safe space for children very broadly, right? And we know this from the school surveys that young people are hungry and eager for that, unconditional support and acceptance, to not, feel judged and so on, especially from adults. But I definitely think asking the questions, and Sandy's here too. Sandy's also could be a great resource in that way, about connecting to schools and how best to support young people who might be dealing with that. Any thoughts from other folks around that?
I think it's a great question, and I think it is still a great opportunity in the schools. In Project Delaware, we work with 3 school districts, so not overall, but I do also support the DOE work from the SEBW side, and I think that there's definitely room for growth and opportunity. And I think it's a discussion that we probably all should continue to have. And Saber Collins is also here from DOE too, to be able to figure out ways to get those services and bring those services into the schools that are lacking, and partnering with the districts who are willing and interested to be able to provide those services. And also having the professionals who know how to provide those services best. So not an answer, but an agreement that that's something that should be worked towards.
So, Mr. Foreman, what I can do after the meeting is send those resources on to Network Connect, because I think the important start, right, is to educate ourselves, regardless of the population, educate ourselves to make sure that we're using affirming language when we have these conversations, so that we don't inadvertently do more harm than good from the start, right? And use this as a space to learn, you know what I mean? In the sense that being open to hearing people say, hey, that language doesn't work for me, or hey, the way that you're describing that, or the way that let me tell you why this program doesn't work for me specifically as this person, and really being receptive to that feedback loop. We can, SEOW will provide you some data and some resources, but it is, I think we do great work here at the SEOW as a team, but these are just conversation starters in some places, right? It's not meant to have all of the answers, because people are certainly more dynamic than the data points. But it's meant to start the conversation, because Delaware is, even though it's a small state, has a lot of diversity within the state, and the experiences of LGBTQ youth in Sussex and Dover are obviously not going to be quite the same as youth in Wilmington. So just starting the conversation, I think, is a great place to lead from.
MJ, if I could just jump
Yes,
in,
ma'am.
I apologize, because Sandy and I are going to have to leave in a minute for another meeting.
Yes, ma'am.
I wanted to say, first of all, we're fortunate that we have this space where we can at least talk about some of the needs. I don't know why my camera's not working today. But there I am. Okay. But what I will say is, when we think about supports coming into schools, because schools can be pretty nuanced places to bring supports in, and I recognize that, I think it's important for us to think about the continuum of supports. And while some students will need may need some very specialized supports, others just need to have that one safe person that they can share their heart with. And so with that in mind, Orlando, you're already doing that by creating safe and affirming spaces for the students that you're working with. And I think as you continue to develop those relationships and become more specialized in the services that you all are providing, then you will see those doors of opportunity open. And in coming months, you might even see some opportunities to work with some of our schools through RFP agreements coming out soon. But short of that, creating those safe spaces, building strong relationships with school staff, so that when young people are in, reaching out or looking for, whether it's an after-school program or a mentoring opportunity, that you all will be, ready to provide that level of support. That's what I'm saying.
And I'm going to piggyback onto what you just said there, Terry. In May in Delaware, we observe Trauma Awareness Month, and the theme of the month is You Belong this year, which I think it is not geared only towards LGBTQ issues, but it's intended to be a broad theme to include all sorts of folks across the lifespan. And I think that I think it's a great focus because, you know, a lot of times we talk about risk factors, but we know that the preventive strategies of inclusiveness, belonging, connection, all of those things are just so elemental to strong and healthy, you know, mental health. So I just wanted to plug that and just mention that we are going to be doing a focus on that for those of you who are in that space. And we just want to kind of highlight that focus.
I love that, Sharon. You belong, because I think that's a message that whether it's through the pandemic or just otherwise, young people need to really hear over and over and over again, regardless of, you know, what they look like, who they love, how they worship, all of those things, that you belong and you matter. And I think you can't emphasize that enough with everyone. You know, I'm an adult, I still like to hear it, but specifically young people, right?
And then MJ, Sharon, Orlando, Terry, we're familiar actually with the program that you may want to consider that's from a school district where they actually surveyed their students and they asked them who in the school that were faculty, administrators, or someone else that was in the school that they could connect with. They also surveyed the faculty and asked them the students that they knew that they connect with. And then what they looked at was the gap. And now you found these students who didn't have anybody. And what they did was they found out how to connect with those students to other faculty members by asking those faculty members if they knew these individuals and could they connect with them. And that's how they closed the gap to get someone individual in the school who each student was comfortable with going to if they were having any issue of any kind, including all the issues we've talked about today. So it's actually something that has worked out pretty well. And then they tied that actually into their local police department. Was kind of interesting because of the Freedom of Information Act, where the police officers, the department would be able to reach out to the school and just say, we just wanted to let you know that your mentor at your school should really reach out to Johnny Smith. And that's all they would say. And that's because something happened with regards to Johnny Smith. And now because that person was at the school, they were able to have that person connect with them, even in a timely fashion when something recently happened. And it has been phenomenal how well this program has worked for them. And it's a very large school district in New Jersey.
Excellent. We do have some of that connect the dots screening taking place in Delaware, but I have not heard about it in relation to connecting community members. So thank you for that. And I'll look forward to learning more. We'll be sharing that with our LEAs.
I was at a presentation at the Kids Caucus at Legislative Hall a few years ago where they talked about, I believe it was in Smyrna School District, where they had a program where if police or emergency services were out in an individual's home, they had a formalized process in place for exactly what Bill just described, where they would then hand off a note. It wasn't anything in particular details, but it was like, I think it was called Handle with Care. And it was a notification that something happened. This child has had some experience.
Yes, Delaware is a part of the Handle with Care network, but we call ours Take Care Delaware because Handle with Care refers to something else in Delaware. We piloted in Smyrna probably about 3 years ago because it was pre-pandemic when we started. We're currently in all 3 counties now. And so, it's operable. You should be hearing more about that. But those calls come in and our school teams are at the ready to provide supports, wraparound supports for students in need. And MJ, I'm sorry, we've got another meeting that we have to go to. Sadie and I are going to try to come back if we can.
I appreciate you, ma'am. I appreciate you adding your expertise to the conversation. You and Sandy. Thank you so much. All right. Our speaker should be here in the next couple minutes, but I just want to check in and see if there were any thoughts, any additional thoughts on the topic at hand or anything else in general that Rachel presented.
I see that Katie has her hand up.
Sorry, I might talk too much, but one of the things that I've been really working on, and I love to share the group, I put in the chat. We've been partnering with the cause and Delaware Prevention Partners, including Planet Youth Coalition, to work on a message of resiliency and positive childhood experiences to do some prevention work. It's called the hashtag #MyReasonWhyDE campaign. Last year we piloted it with some groups. I know Dana, who's on this call, is doing some evaluation of the pilot project. But we piloted it with some groups. The cool thing about this campaign, about the resiliency message, is we work with the youth to create their own message around like why they choose to be in this particular instance, why they choose to be drug free. However, my vision for this campaign, and it connects to a lot of the programs that you all are talking with behavioral health, is to create a positive framework to have kids realize that there are resources, there are reasons why they should be positive and be happy to live, and why they should have sort of this good outlook on life. So we're using it for prevention from drugs, but I really encourage you all to use that hashtag #MyReasonWhyDE campaign and work with your youth to create, again, sort of this resiliency framework message. I don't own it anymore. I want kids to own this. So if you want to connect with me or find out what's happening with that, I could drop my email in the chat, but again, we're working with the cause, we're working with Dana, who's on this call, and we really hope to launch this statewide.
Thank you, ma'am. That's a great point. I mean, one of the values of the SEOW is that we are a cross-sector group, and obviously we have different lenses on how we approach the issue or the topic of cannabis legalization, marijuana legalization, whether that is from an enforcement perspective, a policy perspective, a prevention perspective, an education perspective, our own personal feelings as a parent or as caregivers and things like that. I think it's always an interesting dynamic, which is why the SEOW is really excited to have all of our partners come together to have these sort of conversations, or at least start that conversation. Because regardless of the legal status, obviously there's a health concern that we can't ignore as well for our most vulnerable among us. So other thoughts, other questions, comments? No? Ready? Everybody's ready for lunch?
MJ, just a quick mention for the Attack Addiction. We have our 5K coming up on March 4th in Newcastle. So please feel free to go onto the website and join that great event that we have to honor both hope and also remember all those that we unfortunately have lost to the epidemic. And then also there's a recent article from JAMA in Pediatrics that was huge. It just came out literally yesterday regarding alcohol consumption amongst our teens. And what's significant is the fact that they looked at the age of initiation of using alcohol and then how that progressed to high intensity drinking and how quickly that occurs. And what they showed is that it's significant for interventions, which most of the time they will start to drink as freshmen. And if they progress to heavy incidence drinking by the time they are juniors, this leads to severe alcohol use disorder by the age of 20. Not 60, yeah. 20. It's catastrophic. And their point is that when these events occur, that there should be significant interventions from multiple parties, schools, hospital, whoever, that if you have somebody comes in that age group in high school and that they have those kind of instances of drinking, that their potential for alcohol use disorder really skyrockets. And I can tell you from practicing that we have seen significant amounts of this with regards to individuals. We just had someone come into the emergency room over the weekend, literally 29 years of age, because he had a minor car accident. His blood alcohol was 519. So significant with regards to the level of poisonings that are occurring and their functionality, that they've obviously been engaging in alcohol abuse for quite some time to be that tolerant to that kind of a level when most individuals would have been deceased with a blood alcohol of 519. So it's significant with how it's, but what's interesting about the paper is it does stress about the need for early interventions, especially in high school. And they show trajectories in the paper with their graphs about how quickly that can go up from 9.7 grade level. What they mean by that is just the time that they're a freshman to 11.1, where they've increased significantly to high intensity drinking, which is significant just a short period of time.
Thank you for that.
Yeah. I'm sorry, I'm saying you've given us a great segue into our last bit of business, and that's a resource sharing, among the partners here. If you mentioned your event coming up first,
Sure.
website handy, and you can pop that in the chat.
Mhm.
Also, if you have a link to the abstract on that JAMA article, that would be great to pop in the chat. As you know, we'll pass all of this information out later. We'll have all these links available for everything. So I would just like to broaden the conversation and say, this is that time when we're asking our partners to share out any news that they have, any events that are coming up, activities, new initiatives, thoughts, questions, new products, whatever. We're turning it over to you all now. And thanks for that information, Bill.
I just put the whole PDF link in the chat. So if you click on that, it's going to take you right to the article, not even a link. It's the PDF copy of it. Okay.
Thank you so much.
So MJ, if I can chime in, Orlando, everyone from Network Connect. The month of February, what we have going on with Network Connect will be a free store for the Hope Center community. As you know, a lot of families are displaced. And so we're having a free store out there where they can come and get household items as well as clothing, things of that nature. On February 21st, we'll be collaborating with United Way at the Route 9 Library, a conversation with parents, where we try to get an interaction with the parents and the students to just have better communication skills, which is lacking in the adults and the youth. On the 23rd of February, Network Connect will be having a Black and Wax, which is extraordinary. So the kids will be at Scholar's Turf, reenacting Black history with as wax items. I don't know how that's going to work, but it is going to be quite interesting. And then on the 28th, Network Connect will be having a Black History skate party at the Dover skating ring in Dover, Delaware. And that was on the 28th of February. So it's a way of Network Connect giving back and being a part of our community and doing what we do, connecting with them, letting them know that they have some resources out there. And just wanted to share that. Thank you.
Orlando, would you mind, Mr. Foreman, for those folks who maybe are not familiar with the concept of a free store, could you just give a brief, quick point on what that is?
Yes, so our free stores are actually wonderful. We have a lot of displaced community members for various reasons. And what our free store does, it allows people to come down here and get clothing items that maybe they couldn't normally get. A lot of our clothing items are extremely nice and then great. Some of them are new, actually. We have household goods, furniture, sometimes appliances. You'd be surprised what you get at one of Network Connect's free stores. But a lot of our community members are always thankful and appreciative of what we offer and what we share. And at the same time, we share our different resources with them, letting them know what other things that Network Connect does as far as the community, trauma-informed mental health and substance abuse, our FCC program, which is our future culture creations for our youth, coaching boys into menace, which is my baby. I teach young men how to be respectful to the opposite sex and just try to give these young kids some morals and principles that maybe they might not be getting at home, and just trying to let them know that somebody cares for them.
Thank you so much. If you have an opportunity to contribute to the free store, the great thing about it is not only is it an opportunity to get the resources that you need, it's done with dignity, right? So it's just as if we're walking into Target or Walmart or wherever you happen to shop, that you can come and get the items that you need with dignity, but you can also not only get a coat or a sweater, but you may get a naloxone kit on your way out the door. You may get a COVID test on the way out the door. It's really an opportunity to meet community where they are and provide a more comprehensive approach to their needs. So thank you for that. I appreciate you. Anybody else? Anything else on the horizon?
I just want to mention that MJ popped in the chat, the Network Connect website. I'm assuming that there's information on these events and how to donate, Orlando, on the website.
And definitely check out Facebook for them. Follow them on Facebook. I'm sorry. I didn't mean to interrupt. I apologize.
Yes, no, you're good. Yes, ma'am. Just MJ said that you can check us on Facebook. And we're working on some other areas to try to get the information out to our communities as well. That's an ongoing process. But you can, like MJ said, you can go on our Facebook website and you will see all the different things that we have going on for the months.
Other announcements and news to share.
If I may, I'm going to put my email and a new Instagram in the chat. So any events, services, programs for youth whatsoever that apply to the Brandywine region, I want to know about it so we can put it on our Planet Youth 19809 Instagram, where we're encouraging local parents to follow that Instagram just to get quick image shots of upcoming this, upcoming that. So let's see here. This is the Instagram handle. This is a new initiative, so there isn't much on it yet, but it's coming. And then here's my email. So from recreation to mental or physical health to academic to anything really. We want to aim for wraparound care. And so it was very interesting what I was hearing about the connection between the schools and law enforcement, because we'd like to build that out here. The other thing is that we're using our coalition meeting this month for an in-person train the trainers, trauma-informed teaching and youth program service. So Scott Michaels is running that training. And then in the March, for the March monthly focus, we're hosting the Northern Reality Tour. DSUIF is doing reality tours in all 3 counties. So there are 3 sites chosen. A reality tour is a reenactment of a day in the life of a teen. It involves an overdose, an arrest, and it's done sort of as if the audience is in the middle of things. So we haven't been involved in that before. So this is a new experiment, but the state is excited about it. So figured I should mention that. That's all I have at the moment for the group.
Thank you so much. Anyone else? All right. Well, I appreciate you all for sticking around. And I also appreciate a really rich meeting. We've said it before, we'll say it again. The recording, the slides and the minutes and anything placed in the chat will be sent out afterwards. Give us a few days if you don't mind, and we'll take care. All right. Thanks, everyone. Have a good rest of your day and enjoy your week.
Thank you, everybody. It was great.
Thank you.
We'll look forward to next one.